What is a brow lift?
A brow lift is a procedure which should do exactly what the name implies. It should lift a brow. It is a procedure that can be done from different areas of the forehead. You can either cut just above the eyebrows, you can make a long cut from one ear to the other, and then you can do different versions of smaller cuts here, for example vertical, which you would do for an endoscopic brow lift. So like I said, some sort of axis, 1, 2, or one of those here, and then you try to change the position of the eyebrow. That's the idea. So it is for too low sitting eyebrows, that's the indication. Not excess skin of the eyelid, although that is sometimes sometimes contributing to that. The main thing is to get the eyebrow in a different position or shape.
Will the wrinkles return after having a brow lift?
I think a brow lift is not a great operation to reduce wrinkles. It's really more about the position of the eyebrow, where it sits. Wrinkles in this area here, since we have Botox nowadays, are in most cases better treated with Botox. Having said that, yes, with an eyebrow lift you can reduce muscles here. If you do an endobrow, you can basically take part of these muscles out. I'm not a too big fan of it. I think it sounds a bit better than it actually is when it comes to the result. So in my practice, for wrinkles, it's rather the Botox filler type treatment, and for the position of the eyebrow, it's the brow lift.
Who is the most suitable brow lift patient?
Most suitable brow lift patient is the patient who has too low sitting eyebrows and lots of hair to hide where the cut is, basically. Yeah? Unfortunately, this is a combination that you most often don't get as a surgeon. Most patients who come for eyebrow lifts, at least the male ones, they usually have a bit of a receding hairline, so hiding the scars is not that easy in that cases. Women are a bit more fortunate there because obviously they are less likely to lose their hair. So ideally, lots of hair here, low sitting eyebrows. That's a good patient for a brow lift.
Could I have eye rejuvenation at the same time as a brow lift?
Yeah, you can do that. The only part that I want to mention there is that obviously if I move this brow, two things happen. If I move it upwards, then I produce excess skin here and above it. And of course with the brow lift you can probably take care of that. Now let's do it the other way around. If you put the eyebrow on low, then that also produces excess skin here. And if you do them together, the position of the eyebrow influences the amount of skin which you find here. So a more accurate result you would get if you do it in two operations. Yeah? If you lift this here, let it heal a bit, and then take the extra eyelid skin out. But you can do it both together. It's just the estimate of amount of excess skin that you take out is a bit more difficult to measure, basically. Mm-hmm. Or also to take less predictable. Mm-hmm.
Will I need to take time off work after this procedure?
Yes, I would advise to take about 10 days of work after brow lift. I think that is in most cases sufficient. If you can take more, it's always nice, but 10 is probably okay.
Will there be scarring after a brow lift?
Yes, there will be. Wherever a surgeon cuts skin, there's a scar. The only question is how nice does it heal? Is it a very fine scar that is hardly noticeable? Can you hide it a bit in the hairline or can you not? Or if people have a very weathered face, sometimes if people have, if they just care about the position of the eyebrow and they have, wrinkles all over and they're not too bothered about that, then you can do the direct eyebrow lift, goes especially one line more, so it probably does not matter too much. But you always have scars, of course. I mean, endoscopic probably a bit less than bicoronal that goes from one to the other, but The answer is yes, scars.